Chapter 29, The Prostate, Anatomy, Physiology, Prostatism. Anatomy. The prostate is a sexual organ, partly glandular, partly muscular, lying in front of the bladder and surrounding the prostatic urethra. Figures 52, 65. Figure 52, sagittal section of prostate, bladder neck, and membranous urethra. Division of gland by urethra and ejaculatory ducts well shown. In shape, the prostate is an irregular, truncated cone. It has been aptly compared to a horse chestnut. Its apex rests against the posterior layer of the triangular ligament. Its base, toward the bladder, is pierced above by the urethra, below by the ejaculatory ducts. Its upper, anterior, and lateral surfaces are rounded. Its lower, posterior surface presents a boss on each side of the median line. It is to this lower surface particularly that the title heart-shaped or chestnut-shaped applies. The diameters of the prostate, as given by von Frisch and Thompson, are length 33 to 45 millimeters, parentheses 25 to 30 millimeters, close parentheses, width at the base 34 to 51 millimeters, parentheses 32 to 40 millimeters, close parentheses, thickness 13 to 24 millimeters, parentheses 20 to 25 millimeters. Its weight is 16 to 24 grams. Its position, in position, it is 8 to 12 millimeters below the symphysis, and its apex is 30 to 40 millimeters from the anus. Its long axis makes an angle of 20 to 25 degrees with the perpendicular. The prostate is supported by the puboprostatic ligaments and the levator prostatae, anterior fibers of the levator ani. It is fixed in its relations to the urinary organs by the urethra, which pierces it from base to apex, as well as by the decussation of its muscular fibers with those of the bladder and the urethra. It is separated from the pubic arch above and in front, and from the rectum behind by a loose fascia, the fascia of Denonvilliers, an offshoot from the pelvic fascia, which passes down behind bladder, vesicles, and prostate, separating these from the rectum. Within this fascia and surrounding the prostate, especially in front, lies the prostatic plexus of veins. Gross anatomy. The prostate may be considered as a gland divided into two parts by the ejaculatory ducts. These enter the gland at the posterolateral angles of its base and run through it obliquely, opening finally into the urethra at or near the sinus popularis. That part of the gland behind the ducts is called the posterior lobe. This part of the gland may become carcinomatous. It never becomes adenomatous. The glandular tissue in front of the ejaculatory ducts is divided more or less arbitrarily into an anterior, a median, and two lateral lobes. Loseley has shown that in fetal life these lobes are usually quite distinct, but after birth the glands of the anterior lobe usually disappear, and the separation between the other three, lying behind and to each side of the urethra, is quite arbitrary. The median lobe may be inseparable from one or both of its lateral fellows. The median lobe of the normal prostate makes no projection from its surface. The, quote, middle lobe of prostatism is quite a different matter. The prostate has a thin, fibrous capsule. Microscopic anatomy. The muscular tissue is arranged in so irregular a manner that no two observers are agreed as to its exact distribution. Walker believes that the prostatic muscle is so arranged as to compress the gland as a whole, and each individual lobule of it in particular, but is not calculated to compress the urethra. This view is in accord with the fact that women, who possess no prostate, have complete control of the bladder without any additional muscle to take the place of this gland. The internal or involuntary vesicle sphincter, page 36, is so intermingled with the muscular fibers of the prostate and urethra that anatomists differ as to its proper relation to the gland. The glands are of the compound racemose type with cylindrical epithelium, which may be flattened by pressure or may appear in a double layer. They are collected into lobules, 15 to 32 in number, each lobule surrounded by a layer of muscle and emptying by a duct into the lateral portions of the floor of the prostatic urethra, some behind and some in front of the verumontanum. All these ducts point toward the orifices of the ejaculatory ducts so that the prostatic secretion is mingled with the semen at the moment of ejaculation. A small but important group of urethral glands lies upon the floor of the urethra within the grasp of the sphincter. Occasionally, a few similar glands are found upon the trigone, glands of Albaran. The arteries are derived chiefly from the inferior vesicle. The veins form the prostatic plexus. The lymphatics are very numerous. They pass to the internal iliac and obturator lymph nodes. The nerves are derived from the inferior hypogastric plexus of the sympathetic. The prostatic urethra. The urethra extends from the bladder downward and forward through the prostate, so that, although the major part of the gland lies below and behind it, the urethra emerges quite at the center of the apex of the prostate. The anatomy of the prostatic urethra has already been described. Page 35.